How your sleeping position affects kidney function. What if the way you sleep every night is quietly affecting your kidneys? And you don't even know it? Not the food you eat, not the water you drink, the exact position your body is resting in for 7 or 8 hours every single night. Most people never think about this. But once you understand what is happening inside your body while you sleep, you will not be able to ignore it. Stay with me, because what I'm about to share changes the way most people think about their kidney health forever. In this video, I am going to walk you through every common sleeping position and break down exactly how each one may be affecting your kidney function. Then I will show you what to do instead and give you a set of clear, practical steps you can start using tonight. No complicated medical language, no exaggerated fear. Just clear, honest information your kidneys will genuinely benefit from. Let's get into it. Your kidneys sit in the middle of your back, just below the rib cage, one on each side of your spine. They are not floating freely. They are surrounded by tissue, organs, and structures that are all sensitive to pressure and positioning. And for hours every night, your body weight, your spinal alignment, and the compression around your abdomen directly influence how blood moves through that entire region. So let's go through each common sleeping position and look honestly at what it's doing while you're unconscious. Flat on your back. Sleeping on your back distributes your body weight evenly across the largest surface area possible. Your spine is aligned. There is no compression twisting your torso. Your internal organs, including the kidneys, are sitting in a relatively neutral, unpressured space. For most people, this is one of the more supportive positions for organ health during sleep. Blood circulation through the abdomen and lower back is not restricted. The kidney region is not compressed. The body has room to do its overnight filtration work without fighting through unnecessary physical pressure. The one consideration with back sleeping is breathing. For people with sleep apnea or heavy snoring, lying flat on the back can cause the airway to partially collapse during sleep, leading to reduced oxygen levels throughout the night. And when oxygen levels dip repeatedly over hours, every system in the body, including the kidneys, gets less of what it needs to repair and function efficiently. So if you're a back sleeper and you snore heavily, that's worth addressing separately. But as a baseline position for kidney health, back sleeping is generally sound. On your right side sleeping is extremely common. And for most people, it feels perfectly comfortable. But there are a few things happening in the body during right side sleep that are worth understanding. Your liver sits on the right side of your body, and prolonged right side sleeping places consistent pressure on it. The liver works closely with your kidneys in processing waste products from the blood. When the liver is under physical pressure for hours, its circulation can be slightly restricted, which means it's not doing its part of the filtering process as cleanly. That puts a fractionally higher burden on your kidneys to compensate. Right side sleeping has also been connected to increased instances of acid reflux in some people. When digestive discomfort is active during sleep, your body is diverting resources to manage it. Deep, restorative sleep becomes more disrupted. And quality of sleep matters significantly for kidney health because the overnight hours are when kidney tissue repairs itself and when the body completes much of its cellular waste clearance. Individually, none of these effects are dramatic, but stacked together, night after night, over months and years, right side sleeping adds a layer of unnecessary background stress that your body has to quietly manage every single night. On your left side. Left side sleeping is, for most people, the position that creates the most favorable environment for kidney function during sleep. Here's why. Your lymphatic system is a background network in your body responsible for draining waste fluids from tissues and returning them to the bloodstream for processing. A significant portion of lymphatic drainage runs through the left side of the body. Sleeping on the left side works with this natural drainage flow rather than against it. Less congestion in the lymphatic system means less overall workload on the kidneys, which are the downstream processors of what the lymphatic system clears. Left side sleeping also takes pressure off the right kidney, which is positioned slightly lower than the left, and tends to manage higher circulatory pressure due to its proximity to major blood vessels. Removing unnecessary compression from either kidney during the hours when the body is supposed to be resting is a meaningful advantage. Additionally, left side sleeping supports smoother movement through the digestive tract. When digestion runs more efficiently overnight, your body is clearing waste products through the gut rather than accumulating them in the bloodstream for the kidneys to deal with. Less circulating waste means the kidneys can operate with less strain. If you take one change from this video, making a genuine effort to sleep on your left side is the most impactful place to start. Face down, stomach sleeping is the most physically disruptive position for your internal organs. Full stop. When you lie face down, your entire body weight presses directly onto your abdomen. Every organ in that cavity, including the digestive organs and the tissue surrounding your kidneys, is under sustained, hours-long compression. Blood flow through the abdominal region becomes restricted. The natural pressure your kidneys need to filter blood efficiently is disrupted by the compression from above. Your spine is also forced into an unnatural curve for the duration of sleep. Most stomach sleepers turn their head to one side to breathe, which twists the cervical spine and creates tension that travels through the entire back. The nerves and blood vessels that run along the spinal column directly affect circulation to the abdominal organs. Chronic spinal compression during sleep is not a minor inconvenience. Over time, it creates a consistent background restriction in the systems your kidneys depend on. Stomach sleeping also tends to interfere with deep sleep quality. The physical discomfort of the position causes micro-waking events throughout the night, disrupting the restorative sleep stages where kidney repair and cellular waste clearance happen most actively. If you are a stomach sleeper, this is the one habit most worth changing, and the next section will tell you exactly how to do it without fighting your body. Quick pause before we go further. If you're finding this useful, drop a comment right now. Just type the word sleep below. It takes 2 seconds, and it tells me this kind of content is actually reaching people who need it. It also helps more people find this video so the information gets to more kidneys that could use it, and if you haven't subscribed yet, now is a good moment. New videos go up regularly, and every one of them is built around simple, practical information that most people never hear anywhere else. Now let's talk about what's actually happening inside your body that makes any of this matter. Your kidneys filter your entire blood supply roughly 40 times every day. Every minute, about 1 liter of blood passes through them. They are separating what your body needs from what it doesn't, pulling out waste products like creatinine, excess minerals, and cellular debris, and pushing it all out through urine. Creatinine is a useful marker to understand here. It's a natural waste product that your muscles produce during normal daily activity. Healthy kidneys filter it continuously. When kidney function drops even slightly, creatinine starts to accumulate in the bloodstream. Doctors check this level regularly as one of the clearest indicators of how efficiently the kidneys are working. Now here's where body position connects directly to all of this. To filter blood effectively, the kidneys need consistent, unobstructed blood flow. Think of it like water pressure in a hose. The moment someone squeezes the hose, the water still moves, but it moves slower and less cleanly. Abdominal compression from body position during sleep is essentially that squeeze. Not dramatic enough to cause sudden damage, but enough to reduce efficiency over hours and over years. Beyond circulation, your body goes through distinct repair cycles during sleep. In the deeper stages of sleep, kidney cells actively repair themselves. The body clears accumulated waste from tissues. Inflammation is reduced. Hormone levels that regulate fluid balance and blood pressure reset. All of this requires quality, uninterrupted sleep. A position that disrupts sleep depth or compresses the kidney region reduces the quality of this overnight maintenance window. Sleep position isn't the whole story of kidney health, but it is a nightly variable that most people never account for, and small variables that repeat 365 times a year deserve attention. Tips. Here's what to actually do with all of this. These are small, specific adjustments you can begin tonight. If you've spent years sleeping on your stomach or right side, your body won't cooperate with a sudden change. It will roll back to what it knows the moment you fall into deep sleep. The answer is to set up your sleeping environment to guide the change physically. Place a firm pillow or a rolled blanket along your right side before you lie down. Your body will naturally resist rolling into it during the night, which keeps you on your left. Within 1 to 2 weeks, the new position starts to feel familiar on its own. For left side sleeping, place a medium firm pillow between your knees. This one small addition keeps your hips stacked evenly, prevents the lower spine from rotating, and maintains the spinal alignment that allows blood to move freely through the abdominal region. Use a pillow under your head that keeps your neck neutral, not tilted up or dropped down. Proper alignment throughout the entire spine removes background tension from the systems surrounding your kidneys. Your kidneys work with whatever fluid is available in your system. Drink the majority of your water consistently through the day, not front-loaded in the morning or back-loaded at night. In the 90 minutes before bed, taper off your fluid intake. This reduces middle-of-the-night bathroom trips that pull you out of deep sleep, while keeping your body hydrated enough for overnight filtration to run smoothly. Going to bed significantly dehydrated is equally problematic. The kidneys need fluid to move waste. The goal is balance, not restriction. A large meal late in the evening forces your digestive organs into active processing, while the rest of your body is trying to wind down. The competition for blood flow during digestion reduces what's available to support kidney filtration overnight. Finishing your last substantial meal 2 to 3 hours before bed gives your digestive system enough time to clear, so your kidneys aren't sharing circulation resources with a gut still working hard at midnight. Position matters, but deep, uninterrupted sleep is the environment in which all of these benefits are actually delivered. Consistent sleep and wake times, a dark and quiet room, reducing screen use in the final hour before bed, and managing stress before lying down all compound with a good sleeping position to create the conditions where your kidneys can do their best overnight work. Something needs to be said clearly before we close, and I want you to hear it the right way. Adjusting your sleeping position is a supportive lifestyle habit. It is not a treatment. It is not a cure. It will not reverse kidney disease, normalize creatinine levels by itself, or replace any part of the medical care your doctor has prescribed. If you are managing a kidney condition, elevated creatinine, or any related diagnosis, please continue working closely with your healthcare provider. Follow their guidance. Take your medication as prescribed. Attend your checkups. Those things are not optional, and nothing in this video is a substitute for them. What this channel offers is the layer that formal medical appointments often don't have time to cover. The daily habits, the small decisions that happen outside the clinic, the information that helps your body function better in the spaces between your doctor visits. Think of this as the support work. Your medical team handles the foundation. This is everything built on top of it. Tonight, before you lie down, set it up deliberately. Left side if you can manage it. Pillow between your knees. A rolled blanket or firm pillow behind you so you don't drift back in the night. That's all it takes to start. One intentional setup, repeated consistently, builds a real habit over time. If you're going to try this, type 0 in the comments. I read every single one. It takes 2 seconds and it keeps this channel going, so content like this keeps reaching people who actually need it. If this video gives you something useful, share it with one person in your life who you think about when you hear the words kidney health. You won't have to explain anything. Just send them the link. The video does the work. Subscribe to this channel for simple, honest, practical kidney health information. No scare tactics, no exaggerated claims, just clear guidance built around what your body actually needs. Your kidneys are working for you every second of every day. They don't ask for much. Give them a better night's sleep.